Hi, my name is Corinne, and for about 2 to 3 years I experienced chronic pelvic pain that was only subtle during that time and intensified over a period of about 4 months. I was experiencing extreme bloating. I had this really unusual pulling sensation through the pelvis which became chronic, and the only way to relieve that pain for me was actually to lie down. It was affecting my daily life then as it intensified. And as a busy working mum, that wasn't really consistent with being able to function, and it became quite debilitating. That made me go and seek an appointment with a GP who went on to do some investigations, and I was then referred on to a vascular surgeon. I was then informed I had pelvic congestion syndrome and was explained that was basically varicose veins in the pelvis where the vein becomes enlarged, and that was causing all the pressure and pain that I was experiencing. My doctor reviewed my medical history and other options, and I was, since other medications and treatment options had failed in my case, I was told I was a suitable candidate for ovarian vein embolization. The procedure is where a material is injected down into the ovarian vein, which blocks the blood flow. This is just one of the treatment options which is available for pelvic congestive syndrome. My doctor discussed the options of embolizing both the right and the left vein. I was informed that sometimes anatomically the right vein is difficult during a procedure to access, and in my case my left vein was the vein causing most of my issues and discomfort. I was informed after the procedure at follow-up that the right vein had not been embolized, and the left vein it was evident that the left vein was causing most of my issues, and that we would monitor these symptoms during the recovery phase should we need to revisit any further intervention in the future. My doctor informed me of the usual side effects of having any surgical procedure, and in this case, this procedure had minimal side effects. The main side effects that was discussed with me was pain at the entry site of the neck vein. I underwent an embolization procedure, and within 3 to 4 months, I can confidently say that my symptoms were non-existent. During my follow-up appointment with my doctor, we were satisfied with the results that we had seen, and I no longer was experiencing any bloating, discomfort, pulling sensation through the pelvis that had impacted my day-to-day life. And the only symptom that we did discuss after the procedure was the slight neck pain at the incision site, which lasted about 4 to 5 days. This treatment plan worked for me, and I no longer have to live with the constant burden of pelvic pain. There are a variety of different treatment options available to women, but the treatment option should be chosen and based on a medical history obtained in consultation with your doctor.